A resident in Wisconsin's long-term care facility requests to see their medical chart. The CNA should A. Allow them to view it immediately. B. Explain that only nurses can access charts. C. Notify the nurse to assist with the request. D. Ignore the request. Answer: C. Residents have the right to review their medical records, but CNAs must notify a nurse to handle the process properly. When caring for a resident who speaks a different language, the CNA should A. Speak louder to help them understand. B. Use gestures, facial expressions, or interpreter services. C. Avoid communication altogether. D. Ask another resident to translate. Answer: B. Effective and respectful communication requires appropriate aides or interpreters, not shouting or involving others. A CNA notices a new bruise on a resident's wrist that wasn't present yesterday. The CNA should A. Ask the resident quietly, then report it to the nurse. B. Ignore it if the resident seems fine. C. Wait until the end of shift to document. D. Cover it with a bandage. Answer: A. Any unexplained bruise could indicate abuse or injury and must be reported immediately. When assisting a resident with hearing loss, the CNA should A. Speak slowly and clearly while facing the resident. B. Yell directly into the ear. C. Talk quickly to finish sooner. D. Use long medical terms. Answer: A. Face-to-face, calm, and clear speech helps hearing-impaired residents communicate effectively. The most important step before feeding a resident with dysphagia is to A. Offer water first. B. Ensure the resident is in an upright position. C. Feed quickly before they tire. D. Let them lie back for comfort. Answer: B. Upright positioning prevents aspiration and supports safe swallowing. To reduce infection risk in a nursing home, CNAs must A. Use gloves for every task. B. Follow standard precautions consistently. C. Skip handwashing if gloves are used. D. Only use hand sanitizer after meals. Answer: B. Standard precautions protect both staff and residents from all potential infections. When documenting resident care, the CNA should A. Record facts, not opinions. B. Use abbreviations that are convenient. C. Erase mistakes completely. D. Write details in advance. Answer: A. Documentation must be factual, accurate, and written after care, not predictive or subjective. A resident begins choking while eating. The CNA should first A. Perform abdominal thrusts if necessary. B. Offer water immediately. C. Wait for the nurse. D. Pat the resident's back forcefully. Answer: A. The CNA should act quickly and perform the Heimlich maneuver if the airway is blocked. A confused resident believes today is their birthday and asks for a cake. The CNA should A. Argue that it's not their birthday. B. Redirect the conversation kindly. C. Laugh and ignore them. D. Tell them to stop lying. Answer: B. Gentle redirection maintains dignity and avoids distress in confused residents. When collecting a urine specimen, the CNA should A. Label the container after collection. B. Label the container before collection. C. Mix the sample. D. Keep it uncovered. Answer: B. Specimens must be labeled before collection to ensure correct identification. During catheter care, the CNA should clean A. From the tubing toward the body. B. From the urethra outward. C. Only the catheter bag. D. In circular motions toward the bladder. Answer: B. Cleaning away from the urethra prevents bacteria from entering the urinary tract. To prevent falls, the CNA should A. Keep the bed at the highest position. B. Remove clutter and ensure good lighting. C. Turn off night lights. D. Encourage running in hallways. Answer: B. Environmental safety, like clear paths and lighting, reduces fall risks. When measuring pulse, the CNA should count for A. 15 seconds and multiply by 4. B. A full 60 seconds. C. 30 seconds only. D. Until it feels steady. Answer, B. Counting for a full minute provides the most accurate pulse rate. When a resident with dementia becomes aggressive, the CNA should A. Speak calmly and give them space. B. Argue to correct behavior. C. Restrain immediately. D. Leave them alone in the hallway. Answer, A. Calm communication and distance help de-escalate aggressive behavior safely. What is the safest way to identify a resident before care? A. Ask their roommate. B. Check their wristband and verify verbally. C. Use room number. D. Guess based on appearance. Answer, B. 2 identifiers, wristband and verbal confirmation, ensure correct patient identification. Which action violates resident rights? A. Closing curtains during care. B. Ignoring their refusal of a shower. C. Giving choices in clothing. D. Allowing family visits. Answer, B. Residents have the right to refuse care, and forcing it violates their autonomy. When removing soiled linens, the CNA must A. Shake them gently to loosen dirt. B. Keep them away from uniform. C. Place them on clean surfaces. D. Carry them uncovered. Answer, B. Holding linens away from the body prevents contamination. A resident's call light should always be A. Placed within easy reach. B. Hung on the wall. C. Shared with another resident. D. Removed to prevent overuse. Answer, A. Accessible call lights ensure safety and prompt assistance. During oral care for an unconscious resident, the CNA should A. Use large amounts of water. B. Turn the head to the side. C. Insert dentures. D. Use toothpaste foam. Answer, B. Turning the head prevents aspiration by allowing fluids to drain safely. Before transferring a resident to a wheelchair, the CNA must A. Lock the bed and wheelchair brakes. B. Move quickly to avoid dizziness. C. Raise the bed higher than the chair. D. Avoid using gait belts. Answer, A. Locked brakes prevent falls and ensure stability during transfers. When using a gait belt, the CNA should A. Place it loosely around the chest. B. Secure it snugly at the waist. C. Wrap it over the arms. D. Use it as a restraint. Answer, B. The belt must be snug and positioned at the waist to support safe ambulation. A resident complains about cold food. The CNA should A. Tell them to eat it anyway. B. Report the complaint to the dietary staff. C. Reheat food in microwave. D. Ignore it. Answer, B. Reporting ensures the dietary team corrects temperature issues safely. During handwashing, friction should last at least A. 5 seconds. B. 10 seconds. C. 20 seconds. D. 1 minute. Answer, C. Rubbing for at least 20 seconds effectively removes pathogens. A resident who is NPO should A. Not receive any food or fluids by mouth. B. Have only small sips of water. C. Be given ice chips frequently. D. Drink thickened liquids. Answer, A. NPO means nothing by mouth, fluids may be restricted by medical order. When measuring output, the CNA should measure A. Only water intake. B. Urine and emesis in milliliters. C. Estimate based on frequency. D. Just record once daily. Answer, B. Accurate measurement in milliliters is vital for fluid balance monitoring. A resident with a new colostomy seems embarrassed. The CNA should A. Ignore their feelings. B. Listen and reassure them privately. C. Discuss it with others. D. Avoid helping. Answer, B. Emotional support and confidentiality promote acceptance and dignity. Which of the following is not part of infection control? A. Wearing gloves. B. Hand-washing. C. Sharing personal items. D. Disposing of waste properly. Answer, C. Sharing items spreads germs and violates infection control protocols. When documenting care, the CNA should always A. Chart immediately after care is provided. B. Chart before doing the task. C. Include personal opinions. D. Leave blanks for later. Answer, A. Documentation must be timely and accurate after completion of care. The CNA finds a resident on the floor. The first action is to A. Assist them up immediately. B. Check for injury and call for help. C. Give them water. D. Ignore it if no one saw. Answer, B. Assess for injury and call for nurse assistance before moving the resident. A dying resident requests spiritual support. The CNA should A. Dismiss the request. B. Notify the nurse or chaplain. C. Tell them to pray alone. D. Change the subject. Answer, B. Respecting spiritual needs is part of holistic care and patient rights. During mealtime, the CNA notices a resident pocketing food in their cheeks. The CNA should A. Offer more food. B. Remind them to chew and swallow carefully. C. Force them to eat faster. D. Ignore it. Answer, B. Pocketing may indicate swallowing difficulty and requires gentle reminders. When using restraints, the CNA must A. Check skin and circulation often. B. Leave them until shift change. C. Tie them to bed rails. D. Avoid documentation. Answer, A. Regular monitoring ensures safety and prevents injury. A resident refuses to eat lunch. The CNA should A. Report it and encourage alternatives later. B. Force feeding gently. C. Threaten to tell family. D. Remove the meal tray silently. Answer, A. Report refusal and encourage food later without pressure. A CNA overhears another aide mocking a resident. The CNA must A. Ignore the comment. B. Report the incident to the nurse immediately. C. Join in joking. D. Wait for proof. Answer, B. Verbal abuse violates resident rights and must be reported promptly. A resident's dentures fall on the floor. The CNA should A. Rinse and return immediately. B. Notify the nurse and disinfect per policy. C. Wipe with tissue. D. Ignore and place back. Answer, B. Proper cleaning and nurse notification maintain hygiene and infection control. To prevent pressure sores, the CNA should A. Keep skin clean and reposition regularly. B. Use rough linens for friction. C. Ignore dry skin. D. Massage red areas. Answer, A. Clean, dry skin and frequent repositioning prevent pressure injuries. The CNA should provide perineal care to a male resident by A. Cleaning in circular motions from tip to base. B. Cleaning from base to tip. C. Using the same cloth for all areas. D. Avoiding soap. Answer, A. Cleaning from tip to base removes bacteria safely and prevents infection. The CNA sees a resident attempting to leave the facility. The CNA should A. Block the door and yell. B. Stay calm and notify the nurse immediately. C. Let them go outside. D. Physically restrain them. Answer, B. Calmly ensuring safety and notifying the nurse is the correct procedure. When cleaning hearing aids, the CNA should A. Use alcohol and water. B. Wipe gently with a soft dry cloth. C. Submerge in water. D. Spray disinfectant directly. Answer, B. Moisture damages hearing aids, clean them with a dry cloth only. Which of the following promotes dignity during toileting? A. Leaving the door open. B. Providing privacy and respecting independence. C. Rushing the process. D. Speaking loudly about the task. Answer, B. Privacy and independence protect the resident's dignity and comfort.